Welcome to today's program, and thank you for joining us. I am C. Virginia Fields, former Manhattan Borough President, and currently the President and CEO of the National Black Leadership Commission on AIDS, Inc. And the mission of the National Black Leadership Commission on AIDS is to educate, mobilize, and empower black leaders to meet the challenge of fighting HIV, AIDS, and other health disparities in their local communities. And today, we will be addressing how to reach youth in the fight to end the epidemic of HIV/AIDS. This is so important because young people between ages 13 to 24 account for more than 1 in 5 new HIV diagnoses, according to the Center for Disease Control. And most of those new diagnoses occurred among young men who have sex with men, with young blacks and Latinos becoming especially affected. Yet, young people living with HIV are least likely to be linked to care. In fact, 44% of youth ages 18 to 24 years living with HIV don't even know that they have it. So my guest today, Raven Lopez, wants to help change those statistics. 26-year-old Raven was born HIV positive after her mother, HIV/AIDS advocate and care coordinator Michelle Lopez, was infected. Raven grew up knowing her status, and the experience enabled her to gain her voice, sharing her experience on the Oprah Winfrey Show and other media outlets. She also helps other people living with HIV get access to care in her capacity as a pharmacy sales representative. She's here today to talk about her experiences and how she can reach, and all of us can reach, young people. So welcome, Raven, and thank you so much for joining me today.
You're welcome.
And of course, I've known your mother and worked with your mother, as so many people who will watch this show have had the same experience for a number of years. And we certainly appreciate the contributions that your mother have made in the fight. And as I told you when we first met today, this is my first time meeting you, but I know about you. I know about Raven because Michelle talks about Raven, and I can certainly understand why. So to get us started, why don't you tell us a little bit about a person who was born with the virus, with HIV, with AIDS, and now as you moved into adulthood, like growing up in school, did you discuss it? Was it known? What were those experiences like?
Well, growing up, living with the HIV virus, it was kind of hard for me. I've been stigmatized all my life because due to me being in the media and my mom being in the media, I was a very open person with my status. I always shared people. I'm a little girl living with HIV. I wasn't asking like for sorrows or something, but I was just, sharing my experience. I'm a little girl. I didn't really understand what HIV was, but I always talk about this one incident when I was in the 3rd grade. My teacher, she used to put rubber gloves on in the classroom. I couldn't go on any class trips. She used to put garbage bags around me, all due to me being HIV positive. And, me growing up, I always thought, well, hey, I guess this is how my lifestyle got to be because I'm HIV positive. And, one day my mom just said, you know what, Raven, this has to stop. You was born with this. You didn't ask for this. You don't know what it feels like to be negative. And I said, you're right, Mom. I'm human, what's the difference between me and other kids? And she said, Raven, it's just cool people out there that don't know what HIV is. And, I'm here to show you and, better yourself. And I said, you know what, Mom, I want to start learning more about this. I want people to accept me for not the girl with HIV. I just want people to accept me for Raven. Like, that's the cute little girl that's always happy, always jumping around, always smiling, so, and it was just I always, you know, even though I got made fun of, bullied, I got food thrown on at me, spit on, my hair cut, um, that still didn't stop me from being, you know, educating my peers and letting people know just because I have HIV don't make me less than a person or better than a person.
So, what age, in reflecting upon this, that you actually started using your voice and speaking out more boldly, as you just described? By what age was that?
But I did my first speaking engagement at the age of 9 at the AIDS walk. That was 1999. I got to meet Patti LaBelle, and after that, after I did my speaking engagement, I just felt so, you know, Mom, I could do this because, you know, after I just saw like thousands of people came up to me after saying, you know what, Raven, you're not in this by yourself. We're here with you. We're here for you. And it just uplift me. And then for Patti LaBelle to come, I was very sick that day. I had a cold. I had an ear infection when I was a baby. I always used to have a lot of ear infections, and I always used to be sick. So, you know, that day I just felt so embraced and loved. And I said, Mom, I could do this. I could tell people, you know, share my story about living HIV positive, you know, a little girl growing up with HIV, how it feels, what the struggles that I go through. And from then, I just, you know, started doing, like, getting myself into support groups, you know, doing positive things with myself because, you know, when I had my downtime, I always used to look at my mom like, am I different? Is there something wrong with me? Why is people being mean to me? And she always used to say, Raven, no, you didn't ask for this. You know, still be the positive person that you are. Be that beautiful spirit. And I still have that.
So it's clear having that support from your mother and others who cared about you was important. But before we talk about moving now into an adult and a lot of what you're doing, and even now having your own child, do you believe, or are we seeing changes in responses to children, young children, about your same age, who are living with HIV? Are we seeing changes in terms of how they are being responded to today with everything that we do know, that you don't have to put plastic bags around people, you don't have to wear plastic gloves? What's the scene today?
I would still say the stigma is still there because, you know, it is being a young adult, you know, just coming out there being so public with your status. It is a hard thing because, you know what, you do have to deal with, you know, either is this person going to accept me for me or is this person going to look at me different? So, you know, I would say there are some teenagers or young adults out there that is okay, but not, you know, willing to come out as, you know, how I'm publicly. It does take a big stand to do this. And I would say, you know, the care now that's in this decade, I would say a lot more teens is probably more understanding and saying, you know, want the help.
But what about that younger child, like you were so stigmatized at the age of 6 and 9?
And I think it would take a lot of patience for a mom to, you know, for a young kid, you know, from 6 to I'm 26 now. It takes patience to deal with a kid that's HIV positive, you know, to explain to a 6-year-old what is HIV if they're seeing, you know, things on TV about HIV, you know,
right.
And, you know, Mom, what is this? And, you know, got to explain that to them. So, you know, it just, I would tell a young mom or a mom how to tell a child, have patience with them, you know, just, you know, at the end of the day, they didn't ask for this, you know, just explain to them, listen, HIV, yes, it is something that's harmful, but there's medications out there that could take care of you. That don't, you know, and just make them feel like they're human. Because what does HIV start with? H, human. So, you know, explain to them, let them know that, you know what, you're not. Nothing is wrong with you. You just have a virus that, you know.
So you have a journey and you have a story to tell. So now you're an adult,
yes.
and you have a son. Congratulations!
Yes. Thank you.
And he was born HIV negative.
Yes.
So just tell us a little about how you negotiate relationships to become pregnant, and some of your thoughts about that whole process.
Well, me and my partner, you know, actually he chose not to get on PrEP or any medication because due to me, I have an undetectable viral load, and I've been undetectable for the past 7-8 years now. And we basically chose to do it the natural way. And when I had my baby, I had a cesarean. So that is the best way to, not to give it to the baby. And after my baby was born, he had to be on medication for 6 weeks. And after the 6 weeks, he was negative, and he's going to be doing his third test when he's turned 4 months, and he's going to be negative. The first and the second test.
And how old is he now?
He's 2 months.
He's 2 months now.
And he's going to be 3 months pretty soon. And the first and the second test came up negative, and I know in God's willing hand, it's going to be negative again the third test.
So how do you like being a mother?
I love motherhood. It's a beautiful experience, and I just thank God every day for my baby and me living to see the experience that I could have a negative baby and I could share my story with my baby. There you go.
So you've done a great deal, Raven. I mean, just listening to you today, and again, as I said, talking with your mother, knowing a lot about your story too. But we're still not reaching enough young and older people, because we're seeing increases among persons over the age of 50. And I think that in our work as the National Black Leadership Commission on AIDS, we have affiliates in over 11 cities, and we work throughout partnerships over 100 or so around the country. And what's of interest to me is that no matter how much we now know and how much the conversations move forward, we're still seeing new infections. And somehow the message is not reaching. So how do you think, or what do we need to do to get that message, especially to reach more younger people?
And that's a question that's in my head all the time. What can we do to narrow it down to, let people know that, listen, HIV is real. This could happen with a snap in a finger, and I just say,
not a snap in a finger,
well,
but we
yes.
know how it will happen.
Yes,
right?
yes. But I just say education is the key, and it's just so much. And I feel that the youth, and what I would say, I think it takes media. Like if more actors, if more rappers, or more media people,
young people listen to.
Yeah, that attracts the media attention, that attracts the young adults. I think if we start talking more about HIV and AIDS, like on BET or everywhere else, it will get there.
Is there a rap song about HIV?
No, and I think that will probably be a let me use the young term word, dope thing. That would be a dope thing. Like if someone, raps about HIV and AIDS and let them know, like, listen, how to get it, and I don't know. Look at me trying to make a little rap.
Right,
But
maybe that's one thing to think about, go to the venues where young people listen, gather, talk about things.
We do have our stars out there, like, that does, like, help out and give up like a foundation. Or I know Oprah, she does a whole lot of things with HIV, and Alicia Keys, so like the public rap stars, that I know some people they do stuff in the media, but I feel like it should be more.
And I think I mentioned in your introduction that you were actually on the Oprah show. How old were you when you was on Oprah?
When I was on Oprah, I believe I was 6 or 7.
You were actually verbalizing and discussing living with HIV at the age of 6 and 7.
Because I always had a mom that was just always very straightforward with me. Growing up, I was always into books and always into mommy, when, who, what, why, and so I was very growing up, I was very knowledgeable to things.
That's remarkable. That is absolutely remarkable.
But as I said, I always drove it down. Like, I always thank my God for being here, because they told my mom I wasn't supposed to be here at the age of 7, and look, by the grace of God, I'm 26 and I'm still alive.
So in your work, you mentioned about stigma still being very much a barrier in terms of people getting tested or even getting treatment. What are some of the myths that you find that are still out there that we don't seem to concentrate or focus on as much as perhaps we should as leaders and workers in this field?
I feel, the stigma that people still scared of is, knowing their status, and people thinking that HIV is a death sentence. You know, the HIV or AIDS is not a death sentence anymore. So I think people still have that stigma of, oh my God, I'm gonna die. Oh my God, my life is gonna end like in the next 2-3 months. You know, so I think that's the biggest stigma, that people think that it's still a death sentence, and it's not.
And I guess that's the thing that concerns me a lot, because there's so much information, and I'm not saying people have got to go on the web or the internet
Right.
to learn it, but with as much information that is out there, and with you and others who are out there talking with your peers in the community, we're still not experiencing the breakthrough that I think we should be seeing, based on research, based on information,
Yes.
based on actual stories, such as a person as yourself who was born with HIV and now doing tremendous work. We're still seeing this undeniable truth.
And that's why I'm not gonna stop until, you know, until the stigma is down, until, you know, until there's a cure. Until there's a cure, and I know that there's gonna be a cure for this disease.
What do you think about pre-exposure prophylaxis, of course, which we know, for our viewing audience who may not be as aware, is this medication that a person now can take, a person who's negative,
Yes.
can take once a day, and it has been shown to prevent the transmission of HIV, even if they have sexual relationship with a positive person.
You know, I think it is I have the if and the oohs with it, because, you
Many
know,
people do, by the way.
Yes.
I hear that a lot.
and, you know, it's not, you know, a thing of, okay, I could go have sex with somebody that's HIV positive and I won't get it, so let me just go on let me go on PrEP. No, it's not something that, you know, and I think that's what young adults and young teens think, that, okay, yeah, we got this drug, yay, let's, you know, no, it's still use your condom, still go get tested, still have protected sex. That does not mean, you know, just because PrEP is out there, have unprotected sex.
So we still have to do a lot to change that mindset.
Yes.
It doesn't mean freedom, just go and do
Yes.
whatever and go wild
Yes.
without taking precautions, because they're certainly sexually transmitted infections are not protected by the use of PrEP.
Right.
And
And not only HIV, there's other STDs, there's
Right.
other STIs out there that you don't want to have. So, you know, it's just always, protected sex is the best sex. So,
Right.
you know, it's just, you know, I just feel like we need to get more information out there of, just because PrEP is out there, don't think that, you know, you could go haywire and just have unprotected sex.
And I guess, again, in my work in this field and working across the country, I find the information, again, multitude, lots of information, but we have to keep repeating the same story over and over and over again. That's the area of prevention as we know it. But that's the area also where we see less funding being made available. More of it is moving to the treatment care side. And we recognize if a person is living with HIV and or AIDS, we have to take care. We have to make sure that they get their Medicare, have access to medical care and so forth. But we can't forget the prevention side to prevent more new infections. And that's an area that's really kind of fuzzy right now.
It is, and I totally agree with you on that. And it's just like, you know, sometimes I ask myself, like, why can't we just not narrow it down? Like, what is the glitch that we're missing of not narrowing it down? So, you know, as I said, work still needs to be done, and work is gonna get done. It's just patience and just having patience.
Well, we're now over 30 years into this epidemic. How much patience do we have to have? But I do understand it. So for the community, since we are, again, focusing on youth, are there some specific things as it relates to advocacy that you think we need to do in order to address or get the attention more of our young people and get the story out that you've just even shared with us today?
You know what I say for the young people and the young crowd? I think if they start seeing more younger faces, because when I do like go to high schools and stuff, oh, we're so used to seeing an older person come in. Oh my God.
That's why I don't go into the schools.
So you know what? As I said, I think it takes, you know, hip hop stars and younger faces for the youth and the young adults to understand, you know, protect yourself. HIV is real. HIV, anyone could get HIV. HIV don't have a face, and HIV don't have a look.
So do you do a lot going into the schools?
Yes, I do. And when I go into I like to go into high schools more, because, you know, that's when they're gonna start, you know, that's when they start experiencing sex, or, you know, even from like middle school to high school, I love to go into, because middle school, that's when they start, you know, developing and start catching feelings and stuff like that. So, you know, I always talk to them about HIV, and, you know, not even only HIV, but about dating, how, you know, how to talk to someone about sex, how to present sex to someone, you know. So that's, you know, I think it just takes a lot of more of a, if it take a younger population, or they start seeing more younger faces like as me, or the media, for young adults to understand that, you know, what is HIV.
And another issue that we've discussed from time to time, and that is growing up living with HIV, being cared for by pediatricians, then having to transition from the pediatrician to adult care. And for many young people, that apparently has been somewhat traumatic.
Well, even that was traumatic for me, because I was still seeing my pediatrician until like the age of 21, 22, because I had a hard problem transitioning into adult care, but I had to, because, you know, due to me having a baby, I had to transition. And it's just the process of, you know, going through seeing another doctor, have to build the relationship with your doctor, with a new doctor. And it's just like, you know, once you're so comfortable with your pediatrician, with your doctor that you see on the regular basis, it's like, oh my God, I'm an adult now. Oh God, I gotta go to this adult doctor. I gotta explain this. I gotta explain that, you know. So it is a big glitch to go to just from pediatrician to adult care.
Do you think we're seeing youth, though, fall out of treatment because of the trauma of making that transition? So rather than make the change, especially if the pediatrician has made it known they need to move to adult care, so instead of moving, they just drop out?
I mean, I wouldn't say drop out, but I would say it would take a longer process for them to transition over to adult care, because there's a lot of thinking. There's a lot of, do I want to build that relationship with my doctor? I don't really know that doctor. What does that, suppose if I don't like that doctor, and that doctor know all my personal business, you know? And it's just, it would take more, it's a more slow of a process just to transition right over.
So there are a lot of issues that we have to still confront, especially when it comes to our youth. Well, you've certainly shared a great deal of a wealth of information. So any final thoughts that you want to make sure that young people and all of us capture in terms of what we as leaders and people working in the field are doing or need to do?
I would just say, you know, protect yourself, love yourself, and safe sex is the best sex, and don't be scared to get tested. It's best to know your status than not to know.
I think that's very good advice, and it's very sound advice, and we try to tell that everywhere we go, but I guess we just have to keep saying it over and over and over again.
Yes, you just have to keep drilling it in. You know, it's just like teaching a baby to understand something, basically.
And now that you have this beautiful bundle of joy,
yes,
you certainly understand that.
Yes, I do.
Well, Raven, I want to thank you so very much for sharing so much helpful and personal information. And congratulations to you and your continued work.
Right.
And as we close today, I would say to learn more about the National Black Leadership Commission on AIDS efforts to address HIV/AIDS among young people, please check our website, www.nblca.org. We look forward to having you join us on Facebook, Twitter, Instagram, LinkedIn, and YouTube. The Manhattan Neighborhood Network brings these programs to you to better inform you, the viewer, about the important topics that impact our health and well-being. So please let your family, friends, and neighbors know about this programming. I am C. Virginia Fields, and I thank you for joining us and hope you'll tune in next time for NBLCA's Health Action TV here on Manhattan Neighborhood Network.